so you gather your supplies, you check your record, your patient's diabetic, and you have to go in and check their sugar, AC and HS. AC and HS means before meals and at bedtime, okay? So it's before breakfast, and we need to go in and check our patient's sugar, okay? So we do all the same stuff. That was, you already checked the chart, you knew that they had to have a blood sugar done. So you're gonna go into the room, you're gonna identify your patient, you're gonna tell them it's time for us to check your sugar. Of course, you get the bed to a working height if you need to. All the same universal steps, okay? Before you did that, of course, went in the room, you gathered your equipment. So you're gonna need the glucometer, okay? You're gonna need what we call, what's this called? This is the controls. These are controls, because you gotta need to make sure that your glucometer, is within normal range, okay? A lot of times you can do your controls before you go in the room, okay? Then you also need to make sure you have your test strips, okay? We need to make sure we have something to poke with, and that we have an actual lancet that would go inside the poker. We have a Band-Aid if we need one. We have a cotton ball, and then we have a alcohol swab. Okay, y'all good? Okay, now you will not be able to do controls because most home, this is a home monitor. Most home monitors you cannot do controls on. Okay, they come just standard. In the hospital, you have to do controls on them at least once every 24 hours. Okay, so basically, there's usually 2 controls in here, which of course there's not, there's only one. You have a high solution and a low solution. And usually your controls on the box is going to tell you, or on your controls is going to tell you what your range is, if it's high or low, and it's going to tell you the range that it should be in if you're testing for high or low, okay? So, and you do it the same way, okay? You will get your strip out, okay? You'd want to put gloves on for this, because usually the controls are blue and they stain. So you want to make sure that you got that on. So you activate your machine. Which it ain't activated. Okay, I'll try and make sure something will work. Okay. You'd activate your machine by putting a strip in. Okay. Your strips will have 2 ends. You kind of have an electronic magnet kind of thing on the end, and then you have a little what it looks like almost a little straw on the end. That's what sucks up your blood. So when y'all get a chance, you just look at these. Okay. So you put the magnet in kind of thing in the machine. And when you do that, your machine will usually come on, and it's going to usually tell you the last blood sugar reading. Okay? So it's on. Okay? I got all that. So then what you want to do is you want to choose a finger. Okay? And usually you're going to kind of what they call milk the finger. That's just making sure that you circulate the blood flow in that finger just to make sure you're able to get a good drop of blood. Okay, so you're going to do that just for a few seconds. You don't have to do it for that. Stand there, and it don't have to be weird, you know. So you do that, and then you're going to want to, so that was the patient. So you as the nurse are going to want to make sure the needle's in here.
Do I have to stick myself? Or the person?
Your partner.
You're supposed to. Yes. I know. Okay. So then we make sure we have this on. We got a needle in there, okay? And then you're going to pull back the trigger so it's ready, okay? Then you're going to make sure you get your, usually you don't need a Band-Aid, you just usually need a cotton ball, okay? You're going to make sure that you clean their finger, okay? You allow it to air dry, okay? You also can wipe it off with your cotton ball. And then place it on the alcohol. Okay. Then you're going to, on the side, poke the finger. Okay. You don't poke the finger on the pad or at the tip, because that will cause injury to your patient. They'll feel that later on. Okay. Also, you get better blood flow if you do it on the side.
Maybe seem like he's doing it.
Yeah, my grandma be doing it around me. Yes.
I've been doing that wrong too.
But you're supposed to
Do this
kind
on
of do it on the
patients
side.
every day.
Okay, kind of on either side. Okay, you usually don't
I
want to do
learned
it
it
right
from the
there in the
Ivy.
middle. Yeah. Did I miss something? So, do it on the side, you poke, okay? And then you may see some blood, or you may have to squeeze a little bit. And then you take your glucometer, which is already on, and you get the blood. Just a little drop. And you set it down. Usually you have and a lot of times you'll have a paper towel right here. Okay?
You gonna do yourself?
Do you not wipe the first top, or?
Yes, I'm sorry. You're right.
Cause I see some people.
Yeah, you're right. You're supposed to wipe the first drop
Yeah.
off. Yes, that's correct. And then you would kind of squeeze a little more and then get your blood. Okay? You set this on a little paper towel. Okay? Because you don't want blood dripping everywhere. They set that on a paper towel and it'll read your blood sugar. Then you take this cotton ball and just have the patient apply pressure on their finger. Okay? Usually after a few seconds of pressure, you can kind of wipe it. If it's still bleeding, then you just put the cotton ball back on there and have them keep applying pressure. And usually it don't. And then that'll be it. Then your blood sugar will read, okay? And then you still got your gloves on, so you're gonna take, if it still was bleeding, you could actually leave it on, leave the cotton ball on their finger, and then put the Band-Aid on. Okay, maybe if they're on blood thinners or something where they're prone to bleed, they may need it on there for a little bit longer. They may need to leave it on for about 15 minutes. Okay, so if they do, then you have that available. If not, it's fine. Then you can take your materials right here. You still got your gloves on, and you just get your strip, and this goes in the biohazard because it has blood on it. Okay, then we do that. Then you make sure that you get all your supplies. Okay, now these usually are patient. In the hospital, they have little ones that go for that. You use it and then throw it away. This is actually a home one, so you would change out the needle every time. Okay, in the hospital there'll be single patient use ones that you just put in the sharps container when you get through. Okay, so then you get all your supplies and you gather everything up and you throw everything away, and you make sure you make note of what your blood sugar is. Okay, we're gonna take all this stuff with us. Okay, we're gonna wash our hands. Okay, we're gonna make sure our patient is safe, their bed is low, it's locked in the correct position, the side rails are up, the curtains back, all that kind of stuff, or universal ending steps. And then we're gonna go document, if the sugar is high, you're gonna have to report that to the RN or the physician, whatever one is in your chain of command, and then you're gonna document that. Okay? Any questions? Okay. You all can check